want to post this video with a patient so you can hear straight from a patient versus me talking all the time. And I'm gonna let Justin tell you how he got here, where he's from, that kind of stuff. So Justin, just tell us kind of like what you told me when you walked in the first day, what your problem is and where you're from.
Sure. Hey everyone, my name is Justin from Cedar Rapids, Iowa. I've been dealing with a shoulder injury for the past couple of years actually, and seeing regular physical therapist, chiropractor, received a steroid injection, really not getting the relief that I wanted. Ran across 180 System on Instagram, and right here was talking about how stretching was bad for you. So he showed up on a reel and I saw that video and I was like, wow, who's this lunatic? So then I started stalking his page and I was like, oh wow, this actually makes a lot of sense. And then I figured I'd go and see the man himself and book a couple of appointments to see what he thought about my shoulder.
So I talk about how people choose to come see us and they pass a lot of other physical therapists, chiropractors. So he came from Iowa. So came here, today was third visit over 4 days, 5 days?
Yeah.
Okay, all right. So passed up a lot of other people doing a lot of other stuff because he saw me talking about something that was different, probably the opposite of what he was doing. So what was your experience, what you got when you finally got here and I started working with you?
Definitely more like not covering up the symptoms, more so immediate, I would say immediate response. I was amazed just from a couple of things that you did, and then all of a sudden seeking immediate relief, and then also just better function. I remember talking to my girlfriend after the first appointment. I was like, it was almost like witchcraft. I just couldn't explain it, couldn't describe it. So it was definitely immediate, and then just, it's not traditional.
Okay.
I'm not getting stem, I'm not getting massage. It's unique.
And then talk a little bit about what I gave you to do at home versus what you were doing at home before, the difference in that thought process.
Definitely full range of motion, which that was never really prescribed there, more so just exercises for the shoulder. Yours seemed a little more specific to the muscle groups or the muscle that maybe have been giving me the issues to begin with, to keep them fired up and working as they should. So.
Okay. And here versus what you had done before, did I do more total body things than the previous physical therapist just focus on, okay, this is what you're coming in for, that's what we're going to do, whereas I kind of like went all over the place.
Head to toe screen, and then figuring out maybe if other things were giving me issues and compounding. So yeah, that was definitely different as well.
Okay. And then did the exercise that I give you include everything, or did it focus on just one?
Definitely a full body routine, so that was different as well.
Okay. Let's see what else. So as far as results, so today, like we said, third visit compared to like 3 visits that you got at the conventional PT. What was the difference in results?
Drastically different. I would say less pain. I'm curious to go actually home and test it, to do my normal workouts to see how that is different than it was previously. Obviously traveling, it's hard to get a gym and to do some of that stuff to test it to the extreme, but yeah, I will be excited to do that. But I would say range of motion and then just decrease of pain, feels more stable, just with a couple of things I've done here in your guys' gym. So definitely a lot different.
And with him, it wasn't like he had full range of motion when he came in. He had pain at the end range of motion with flexion and abduction, left shoulder. And this was a snatch injury that he had way back in
21.
Okay, so he's been putting up with this with conventional PT, chiropractic, massage, all that kind of stuff, home treatment since 2021. We got it covered in 3 visits. And when he came in, like I said, it wasn't like he was a disaster. So a lot of people come in and can't raise their arm over their shoulder. This was not him. So his issue was more pain at end range of motion, even though he had normal active range of motion. He had weakness at end range of motion. So he had instability at end range of motion, which was causing his problem because he's a firefighter, he's an EMT, he wants to do CrossFit, had to stop doing CrossFit because he couldn't get the shoulder figured out. So now he's doing other stuff. So he's asking a lot of his shoulder. So a typical person probably wouldn't even have the pain that he had because they wouldn't be pushing it through the range of motion and doing the things that he's doing with it. But this is stuff that he has to do. He can't say as a paramedic or a firefighter, well, I'm just not gonna have full range of motion because it just hurts. So that's not an option. Okay, so we took what most people would not call a problem and found out why that specific thing was happening at that end range of motion, what muscles are involved, and what the rest of his body has to do with what's going on here. So we worked on his feet, worked on his legs, because that's what's supporting and feeding up into the shoulder, especially when he's working as an EMT and a firefighter. So these are the things that the conventional model misses, which is why he's been putting up with this since 2021. So if you've got patients that have had chronic issues, the reason why they're having chronic issues, and they're a healthy adult, this isn't somebody who's 80 and has degenerative discs and all that kind of stuff. So we're dealing with a healthy, active adult. So why is he having the same problem over and over if he exercises? So if exercise fixed the problem, his problem would have been fixed a long time ago. If modalities fixed the root cause of the problem, would have been fixed a long time ago. If stretching fixed the root cause of the problem, would have fixed it a long time ago. So the problem is he's dancing around the root cause and chasing symptoms with the conventional thought process instead of getting to the root cause, reversing that, which is what we did in the first visit, and then gave him things to work on at home. So when you came back for your second and third visit, were we doing less on the table and more in the gym? So the first visit, I probably only had you on the table for 20 minutes. Caitlin probably had you on the table for less than that the last two.
Yeah, I mean, she still did a full body screen and evaluation.
Yep, but doing less, like turning. So when we're turning, the muscle back on,
it wasn't like we were restarting from square one.
Yeah, so
pretty much picking up where we left off.
Yep. So his home exercise program, the purpose is for him to keep things on as much as he can. Now that he's kept those things on, now he's going to go back to Iowa, and he's going to maintain the active dynamic warm up that we gave him to hopefully kick things on so he can maintain what we did here. And now he's going to progress with muscle endurance and muscle strength. So hypertrophy can now be worked on, okay? So the whole point is every time you have a patient come in, they should be progressing, so you're doing less and less with them. They're coming in fewer and fewer visits and doing more and more on their own because you did your job by identifying the root cause and reversing the root cause, educating them as to what to do that will help them rather than tear themselves apart by doing stretching and all the stuff that he was doing before. So just wanted to give you an overview of what it looks like and how, if you're thinking about opening your own clinic, if you're doing something that they can't find somewhere else, they'll find you and they'll come to you, and that's your marketing. So I don't pay for Facebook ads in Iowa. I don't feed physicians in Iowa. But because he saw me say something different and he knows that he's been struggling with something, he was like, well, it's worth my time and energy and money to go see this guy in Colorado, who I think is probably batshit crazy from what he's saying on these videos, but we're gonna find out for real.
We found out. Not crazy.
Not crazy. All right. So thanks for coming in and shooting the video.
Yeah, absolutely. It's been a pleasure.